That's awesome. All right, good morning. I am where I always am when I follow David, which is awestruck and a bit scared, which is probably a good thing. Can you pull my PowerPoint up, please? No? Oh, okay. Is it possible to put it on the computer? It's not? Okay, I would have expected better tech from you guys, seriously. Okay, hopefully they're going to try to work that out. I'm really delighted to be here. I appreciate the graciousness of David's introduction, and I will tell you that he hasn't heard me deliver a talk since I defended my dissertation, so it's been 13 years, I think, but I'm really pleased to be here. And when I told my family that I was doing a talk at a conference about technology and engineering, my engineer husband said, oh dear, did they make a mistake? And my 14-year-old said, Mom, do you need me to come with you? I know you're not good at that stuff. So, you know, what can I say? I'm here despite the lack of support. So, okay, I don't know how to manage this with the technology. Okay, so what I was very happy that when David invited me to come, he didn't expect me to talk about technology. He wanted me to talk about something that's near and dear to my heart and has been for many years, which is the situation of family caregivers of folks with intellectual and developmental disabilities. And so in the time that I have allotted, I'm going to share with you what we know about family caregivers who are caring for a loved one, whether a child or an adult with intellectual and developmental disabilities. And the plan for my talk is up there. I'm going to share with you the characteristics of family caregivers that I think make them a unique group within the United States and one that we should really care about as we think about public policy. I'm going to talk about the size of the population, some of the demographic characteristics, how those characteristics are shifting over time, and then talk a bit about their health and their financial well-being, some of which has been alluded to this morning when Renee and David were talking about poverty being such a significant problem. I'm going to put some numbers to that. And then I'll close with a bit related to the policy context of caregiving. So, okay. So in terms of unique characteristics, what we know about family caregivers is that caregiving is typically lifelong, which is really not necessarily what people understand about our community and the world that we work and live in. But as we've seen a wonderful expansion in the life expectancy of folks with intellectual and developmental disabilities, what has happened is that families' caregiving trajectory has extended well into old age. And we're seeing wonderful successes in terms of health and well-being. And what that is meaning, though, is that family caregivers basically are doing the job for life. And I think that has profound implications for us as we conceptualize what should be the service system for people with intellectual disabilities and their families. A second unique characteristic is that family caregivers are called upon to have really specialized knowledge, not just about their child and about their child's needs, but also about all of these different domains of service through which their child or later adult child receives services, beginning with early intervention, sometimes having to fight to get a diagnosis, on into the education system, the pediatric healthcare system, transitioning, if they can, into the adult healthcare system, often a transition into some kind of vocational services and supports, and possibly a transition into long-term care and the formal residential service system, which looks so different across the country. And we really expect family caregivers to pull all these pieces together And to keep all these balls in the air as they are navigating really complex, completely siloed service systems, as they are fighting for the needs of their child and to try to get their child services. And we expect them to be experts in all of those. And I have a Ph.D. in public health from UIC that David was wonderful in mentoring me in, and I can tell you that I struggle to sort some of these things out. I struggle explaining to my students the complexities of Medicaid. I struggle, and I've got plenty of years of education, and yet we expect parents and often later siblings to be experts overnight, and if they're not, you know who suffers? They do, and so does their child with disabilities. And I think that the complexities of our service system are where we as a society start to fail families. What has also happened over the last, I would say, couple of decades is that we have really increased our expectations of the kinds of specialized care that families are expected to provide. And as we have done a very good job prolonging the lives of folks who have really complex health needs, who has to provide intense nursing care at home? Oftentimes it's the parents. And oftentimes the supports that are available are woefully inadequate. And yet we have the expectation that parents can step up and can do everything that their child needs. Even though when we were in the era of institutional care, we would have service systems that would have experts from multiple fields who would attend to all of these different needs. Next is the issue of the costs of caregiving. It is very expensive to live in the United States with disabilities. That's true if you're a family who's raising a child with disabilities, and it's true if you're an adult who, him or herself, has impairments. Our service systems don't cover all the costs that are needed by people with disabilities, and we certainly don't have full insurance coverage for most things. We also know that caregiving is chronically stressful. It takes a very heavy toll on caregivers, particularly caregivers who are lifelong at the job. And our family support system, as I'll share with you in a moment, is inadequate in helping families to manage all the stressors. We have new evidence that talks about the health consequences of caregiving, and I'll share with you some of that information as well. What we're starting to understand is that caregiving itself exerts a physical cost on family caregivers. And despite all of this, and I paint a fairly negative portrait, despite all of this, we have caregivers across the country who are resilient, who are amazing advocates for their loved ones with developmental disabilities. We have caregivers who are just indomitable, and I am in awe. I am absolutely in awe of the things that they are able to accomplish, despite a system that is really set up not to make it easy for them. In fact, sometimes you have to wonder if it's set up to do quite the opposite. So now what I'd like to do is walk you through some numbers and try to paint a picture of where things are in terms of numerically. So Glenn Fujura at the University of Illinois at Chicago, he's analyzed data from the Survey of Income and Program Participation, and what he has found is that almost 3 million individuals with developmental disabilities are living in the community. And did you know 80% of them are living with family caregivers? 80% of them. This is profoundly important when we look at some of these other numbers and we think about where the dollars in the service system are going. And the second piece of information comes from David's State of the States study, where he has indicated that in 2011, there were just over 613,000 people who were receiving formal residential care in the United States and who have intellectual and developmental disabilities. Our current waiting list across all the states that keep them is over 73,000 people with intellectual and developmental disabilities. That's 12% of the current number who are receiving residential services. And now look at the really bad part. So families are caring for 80% of folks with intellectual and developmental disabilities. So wouldn't you think that they would be receiving a fairly large segment of the spending that goes into our service system? And yet they do not. What we know from David's data with the State of the States project is that in 2011, out of the almost $57 billion that was spent on developmental disability services, families got 7%. If you're not angry, I'd like you to wake up. Okay? And I'm very serious. This is a travesty that we have a service system that rests on the backs of family caregivers and doesn't honor them for the hard work that they do. Thank you. My 14-year-old is not going to believe I got applause. That's just not going to believe it. All right. So I want to talk a bit about the demography, the characteristics of family caregivers across the United States. These are data that we've pulled together, and the journalist Richard Rodriguez has talked about the browning of America, the fact that our nation's demography, our racial and ethnic identity is changing. We know that we're having larger growth in the African American and Latino populations than we're having in the white populations. So when we look at caregivers, we're still seeing that a majority are white, about 66%. This is caregivers of all ages, and then about 12% wait a minute. Okay, about 12%, you have to forgive me, 12% are Latino, and then about 17% are Black or African American. Now, if we look at these data for just the population of children with developmental disabilities, we see already changes to the demography, and only about 61% of kids with developmental disabilities, if we look at data from the National Survey of Children with Special Health Care Needs, are white. So we are certainly in a situation where we need to be doing a better job recognizing the different cultural heritages and frankly, the racial disparities that these families face across the board. And what about the age of family caregivers? This pie chart shows you that it shows you the distribution essentially of family caregivers, again using data from the SIP, and the number that you want to pay attention to is the 19% in dark blue. Those are family caregivers who are age 65 and older, 19%. Now, to take all of those folks with intellectual disabilities living with a caregiver who's 65 or older, that would take about the current 2/3 of our residential service system. Okay? The states are clearly facing an impending crisis in their ability to respond to the needs of caregivers who are aging and who are oftentimes grappling with their own health needs and their own increasing frailty.
Technology. We're talking about digital computing. Well, no.
And so this is a bit of information from Glenn Fujura, again using data from the SIP, and he asked the fairly simple but extremely important question about the physical health of caregivers who have a loved one with intellectual and developmental disabilities. And so as you are looking at this on the left side, that is the percent of all family caregivers who report being in poor health. And then I've broken it out, differences we know by whether or not a family is headed by a married or a coupled partnership, or whether it's headed by a single person. The dark blue, those are family caregivers who have a loved one with intellectual disabilities. The light blue is everybody else in the general population. And what you can see is that poor health is vastly more common among family caregivers who are helping to support an individual with intellectual and developmental disabilities. And there are significant consequences for us as we think about what is the role of public policy to support caregivers who are doing significant work in their own homes to take care of their loved one and whose own health is in fact quite poor. Marcia Malik at the University of Wisconsin has done some really interesting work looking at older adults who are parenting
first, let me say that,
youth and
people
then
are
young
talking-
adults with
a lot of what I hear
autism.
so far
And in some
is
cortisol
tying
studies, what
to
she is finding
today's
is that
systems, the
chronic
web,
stress and
all this
fatigue
stuff. And that
absolutely
is,
are taking a physical toll on these
ridiculous because
mothers,
it's
which is
these-
certainly
these-
not
all these
surprising
systems,
really to
even for
any of
typical
us.
people with children in infancy. And in
What
particular,
she's
I'm
finding
very
is, though,
concerned
that
about
in her
tying
studies, the
public
mothers are
policy
showing
to
hypoactivation,
outdated
which is
equipment,
essentially
right? So I
the
think
same
we
response
talk
that
about
parents would have if they're raising a child with
capabilities
cancer
and
or
not-
the individual
and
who is
not
responding and having
particular
post-traumatic stress
instantiations.
disorder. And so she has not done her work on the larger population of folks who, of moms who are raising kids with intellectual and developmental disabilities, but I suspect that if she did, she'd find essentially the same results, particularly when we are seeing situations of children and adult children who have behavior problems, which we know is a significant problem in our field, or when children have comorbid health conditions. Again, very common in our field. So we need more
well,
work to
I mean, right, a lot of
understand
this
this,
is
but
not
this
a
is very
technological
important
issue.
physiological evidence
it's a
as opposed to
social,
the self-report
and
measures
sociological
that really
issue, right?
suggest
I mean, I've been
that
dealing
our
with
public
all the
policies
government
need to better
websites just
respond
put in
to the health
an
and
age
well-being
proposal.
of caregivers.
And
Now,
you
as
can
we think
tell
about the changing
stovepiping
demographic profile
because,
of the
you know, I
United
put
States,
stuff
the
into one
browning of
system and they
America,
say, "It'll
as
take
Rodriguez
10
calls
days
it,
to respond,"
I
right?
think it's
And
very
you know
important
it's
for us to
because
continually keep an eye on racial
they're talking to
disparities.
another
We know we
agency
have enormous problems
that,
in this
you know, that
country
has some extremely
related to
permanent
racism,
effects.
segregation in
There
housing,
is
the asset
no-
gap, the income gap,
know,
wage
that is
disparities,
not
and
a
so forth.
technical
And
issue.
Sandy
That
Magana at
is
the University of
a,
Illinois at Chicago
that
has
is an
tried to
organizational issue, and it's a
understand
failure,
what are
quite
there
frankly,
health differences
some of
as
these
well.
managers
And what
who
she
bang
has
heads
found
together.
is that there seems to be cumulative adverse effects for Latina and African American mothers in particular who are raising children with developmental disabilities or who have an adult child with developmental disabilities. And she's finding elevated rates, elevated rates of arthritis, depression, poor health, all of which are very worrisome as we think about these family members' capacity to continue to provide care for their loved ones. What she has also found, though, that I think is really interesting and certainly worth us understanding more is she's finding actually better emotional health outcomes for African American caregivers. So it would be helpful to us to understand, what is driving some resilience emotionally among those caregivers. I know that work that Jan Blatcher has done from UCLA, she's actually found elevated rates of depression for Latina moms. So, I think we need to do some more work to understand this.
Very old way of
Okay,
looking
and
at
this is a busy
problems
little chart,
that,
but what I wanted to show you
is
is
very limited.
a bit of
And,
numbers
that's not
that
gonna
help
change
you to
anytime soon. The
understand
question is,
what
how do we-
happens to
how do we
families.
make use of
I see.
the legal
Okay.
system we've got to not mess
Okay, I've just
things
been
up
given the
any
sit
more than-
down.
than is necessary.
What happens to families' financial well-being when they're
Okay.
raising children
Okay, yeah,
with
and if I
developmental
rant for too
disabilities? And
long,
so what
just
you're doing
cut me
here
off.
is you're looking
Okay.
at a slide
Yeah.
that has 3 common measures of financial well-being. The blue is net worth, which doesn't include housing. The red dotted line is annual income, and then the red line that hugs the bottom axis
Thank you.
is liquid assets.
Hope it made
Liquid
some
assets
sense.
being cash
Okay,
available
okay, good.
in the event of an emergency.
There's
What
nothing
kind of
wrong
money
with
do you
learning
have
new
access
stuff.
to? And so what you're,
That's why I'm
and
here, is
as
to
you're
learn new
going
stuff.
across this from left to right, you're looking at the situation for younger caregivers as they age. So the furthest points on the left, family caregivers who are under 45. We expect younger adults to have the lowest levels of income earnings of all kinds and savings. That's developmentally appropriate. Adults typically hit their peak earning years right close to retirement, which is actually the third set of dots that you're looking at. And what we see here instead is that for we do see a dip in income, that's the middle line, as people enter retirement, but notice that we also are seeing a dip in net worth. So we see some evidence here that families are likely having to tap their savings to meet their obligations. And the piece of information here that I think is really worrisome is that bottom line across there. So what it suggests is that the average liquid savings, cash on hand, what could you get to this weekend if you really needed money in an emergency? For adults who are under 45 and have a child with intellectual disabilities, the average is 0. Okay, and it goes up to a whopping $285 on average across the United States for families who are near retirement. So as families have health crises, as families have equipment that breaks that needs to be repaired, they don't have access to the resources that will help them take care of it. Another way to look at this is what's the percent of families who have a child or an adult with developmental disabilities who have 0 or negative liquid assets. And you can see that across all age groups, it's really worrisome. It declines as we would expect it to, but it's really worrisome that families in a crisis are up a creek. Okay, and another way of looking at this, these are households headed by either a single mom, those are the light blue, or a married mom, those are the dark blue. Not surprisingly, we see better outcomes for married mothers. We know that that's the case nationally for every type of family, but look at the high rates of families who are poor or near poor. And just as a reminder here, the federal poverty level for a family of 4 this year is $23,850. So these are families, so for a family of 4 with less than $48,000 a year in income. And you can see that it's almost 2/3 of single moms who are raising kids with developmental disabilities. And it's incredibly high. More than 1/3 of married couple families who have a child with developmental disabilities are facing, essentially don't have enough income. When poverty scholars think about the poverty line and what does it take to actually sustain a family, twice the federal poverty line is what it takes. So these are families, the near poor, who don't have enough resources to make ends meet. And then in terms of the farthest right set of columns, asset poverty, this is families who don't have the equivalent of income at the federal poverty level for 3 months. So these are families who do not have adequate savings. They could not sustain themselves for 3 months, even at the federal poverty level. So it's a very worrisome picture in terms of the financial well-being. And so what's the policy context? David talked this morning, and several other folks did as well, about the importance of Medicaid, which undergirds more than 3/4 of the developmental disability service system. We know that from David Braddock's work. Medicaid represents the single largest expenditure that states are making, and while we certainly are in recovery from the Great Recession, we are nowhere near a point of making the investments in Medicaid that we need to make. And so what we're seeing is that states are still struggling to meet their obligations. The states, unlike the federal government, can't borrow, so their situation is much different. We certainly are still expecting that projected average annual Medicaid growth is going to exceed growth in the gross domestic product. So we're still seeing the situation of the projections for Medicaid, really being alarming. And I think a related note to that is we have actually seen a slowdown. In fiscal 2012, there was a slowdown in terms of Medicaid spending, but states are still struggling. And finally, the Affordable Care Act, Obamacare, it does not address the needs of family caregivers. So what really matters is where families live. David Braddock's data has shown this year in and year out that only 13% of American families receive family support services. The range is vast, from no families receiving family support in Idaho to just over 1/3 in Wisconsin. You should be saying 1/3 is not adequate either. We know families that live in states that have more generous Medicaid programs, they spend less money on their children's out-of-pocket health care costs. So the state of residence absolutely matters. And we need to pressure state legislatures to support Medicaid in ways that support families. So in conclusion, I want to leave you with a couple of questions. The first is, how can states address the needs of aging parent caregivers as we face the situation which we welcome of increasing longevity of people with intellectual and developmental disabilities? Second, what are the long-term consequences of chronic poverty and deprivation? In work that my team has done, we see food insecurity among middle-class families who are raising kids with disabilities. We see the loss of housing. We saw utilities getting cut off with families who are making $60,000 a year and more. So deprivation is happening in families that we wouldn't typically expect it to happen in if they're raising a child with disabilities. That situation is much rarer in families who don't have a child with disabilities. And so now the technology questions are, can technology help families? Can it break down these siloed service systems that most families have to interact with? Can it help families meet their need to provide increasingly specialized and complex care for their children with intellectual disabilities? And can technology address the pervasive racial and ethnic disparities in the physical health burdens that we see among caregivers? And I'd just like to close by saying thank you. I'm so pleased to have had the chance and really grateful for the invitation, David. So thank you very much. An acknowledgement to my co-authors who at this point are all over the world. And thank you very much.